have been aimed at building
Namibia
an
is yet to receive its share of the AstraZeneca vaccine through the COVAX facility after it made an upfront payment of more than $27 million. The arrival date of the 127,000 doses has been delayed at least 3 times, with the WHO's most recent confirmation it will arrive in another 2 weeks' time.
We applied equally a COVID vaccine facility. Up to now, we didn't get anything. We got help from our good friends from China and India who gave us vaccines so far. We put the advance, we had the advance payment at this, but there is this exclusion. The COVID apartheid is now prevailing. That we, as a small country in Africa, who already made our deposit, are up to now waiting to get our vaccines. That is not good.
Namibia's frustration over the delays is being shared by countries such as Barbados. The island received 33,600 doses of AstraZeneca vaccine on Tuesday after kick-starting its program with 100,000 doses donated by the Indian government.
Bottom line is that we have also separately been regarded by the global community as countries that have come out of the depths of poverty and therefore are not deserving of assistance in the traditional ways normally reserved for the most vulnerable. This has made life difficult. We've held on to the promise of COVAX, and I've come to you this morning having received the first tranche of Barbados's vaccines, 3% of our population, with respect to the COVID vaccines this morning. But for many globally, this has been a difficult exercise because as we've seen, the spikes can literally grow. We've not had access even when we are prepared to pay.
Calls to improve access to COVID-19 vaccines is part of a 5 urgent action plan launched by the WHO to help improve global health. Other points include boosting countries' post-COVID-19 recovery budgets and plans to protect and prioritize health and social sectors. This is due to the fragility of health systems as exposed by the pandemic.
Scaling up production and equitable distribution remains the major barrier to ending the acute stage of this pandemic. It is a travesty that in some countries, health workers and those at-risk groups remain completely unvaccinated. The effort to achieve vaccine equity will not stop this week. WHO will continue to call on governments to share vaccine doses and fill the $22.1 billion gap in the ACT Accelerator for the equitable distribution of vaccines, rapid tests, and therapeutics. We will also look to find new ways to work with manufacturers to boost overall vaccine production.
As the world commemorates the World Health Day, countries are also being challenged to improve data collection and report where health inequalities are found and address these timelessly. Blanche Goreses, NBC News, State House.